Okay, so I think with that I've tried to answer the question that Tim put to me, which was, do nerve blocks lie? And I've tried to illustrate that they don't really, if you are aware of their limitations and pitfalls. In the second part of my talk, I would like to explain some of the ways that we've tried to elucidate how they can be helpful. Specific these techniques can be in localizing pain in the foot. And part of this arose from the clinical question that always that is always put to us when we see a horse like this being presented to the clinic. A horse with a really weak thoroughbred type foot. This happened to be an Olympic event horse in a pre-Olympic year. The horse was struggling with chronic foot lameness, and the selectors wanted to know if the horse had navicular pain or was it just to do with foot balance, and if it was to do with foot balance, could they manage it, and could the horse still be successfully selected for the subsequent Olympic Games. So the question was, does the horse have navicular pain or does it have heel pain, for lack of a better word? And the answer to that has to rely to some extent on this equation as to whether or not it's possible to localize pain in the foot based on the differential response to this series of blocks that we can use. And I know we've moved away from this a little bit, in that sort of paradoxically out of all this work seems to have come the realization that no matter what you do, if it's a Palmar digital nerve block, you can still use imaging. But I do maintain that I feel that if you look at these blocks and compare their results, that you can go a long way towards identifying which structure it is that hurts. So what could we, when I used to go to vet school about 20-something years ago, we were told the following, that a Palmar digital nerve block blocked the Palmar half or the Palmar third of the heel, that a proximal digital nerve block or an abaxial sesamoid nerve block blocked the whole foot, dorsal and palmar aspect of it, including the pastern joint. That what you injected in the coffin joint blocked the coffin joint, and what you injected in the navicular bursa blocked the navicular bursa. In the end, that's not how it goes. I think we all realize that now. So how does it go? That's what I'll try and explain in the remainder of my talk. So most of this is research work that was done by the Schumacher brothers, especially by John Schumacher at Auburn University. And many of these results were summarized already a while ago in Equine Veterinary Education. And in fact, this year, or at least last year, this paper was reworked, new information was added, and you can find the most up-to-date version of this paper in Equine Veterinary Education. I think it's 2012. So what I'm going to do is review some of the results of these studies in order for you to help you understand how these blocks can be helpful in distinguishing pain between the different compartments of the foot and the distal limb. And in order to get to this level of realization, we used two models of pain in the foot. The first one was a pressure model, where we used a shoe with nuts that were welded to the inside branches of the shoe in the heel region and in the toe region of the foot. And then we would take a set screw, tighten it into those nuts until there was a clear lameness visible at the walk and at the trot. So here is an example of a horse with induced solar pain. Now the beauty of this model, before you put your hands up in horror, is that it's completely reversible. You take the screw out and the horse is fine. Okay? Occasionally one or two horses had a bit of a bruise that took a couple of days to get over with Butte, but usually you take the screw out, the horse is fine. The other thing this video clip allows me to do is put credit where credit is due. That's John Schumacher, who's behind most of this work. The second model we used was a model of endotoxin-induced pain, endotoxin-induced synovitis. And this was used in the coffin joint, in the navicular bursa, in the pastern joint, and also in the femoral joint. The problem with E. coli-derived endotoxin is that it's very much batch dependent, so you can't always use the same dose. With some of these batches, the virulence is so low that you need a lot higher dose than with others. So it's a bit of a struggle, but anyway, we've got enough information together to make up a nice story. So here's a horse with synovitis in the coffin joint, distal interphalangeal joint. So you see from these video clips, there's not much question. We're not talking about subtle lamenesses. These are black and white situations. These are horses that are very lame, and then you look at the block, and then there's a clear response that allows you to make a conclusion.